Hi everybody, it's Dr. Mary Gardner and I appreciate you joining me today. I am wanting to talk to you about skin cancer in dogs and cats. So dogs and cats can get very similar diseases as humans can, ranging everywhere from diabetes to cancer, which I'm going to talk about today. But I want to just focus it a little bit on skin cancer because there's a lot of different types of cancer. So, and I really wanted to bring this up because of a recent incident with myself. And so I am technically an 80s child. So I wasn't born in the 80s, but I was an 80s child. And that meant I was at the beach all the time, basically lathered in baby oil, capturing as much sun as I could. And at the Jersey coast, the Jersey Shore, if you will. And we really back then did not protect ourselves well. And so unfortunately, I'm feeling the results of it now. And so 2 weeks ago, I went to a dermatologist because I had a small, we call them lesions, but a small bump, if you will, on the side of my nose. That it didn't have a different coloration, so it looked like my skin color, but it was just a small raise. I mean, it was barely noticeable. And it kind of just sat where, if I put my sunglasses on, where my sunglass, the little notches hit. So I went to have it looked at because I've had it for a few years. And so they said, okay, well, we got to take a little sample of it. So they took a little biopsy and the results came back that it was a basal cell tumor, which luckily it was a benign type of tumor and not very aggressive and is not malignant. And so, but the fix for it is to actually have it removed. I did not have to have it removed, but it could grow larger and then cause some issues later on in life. So I decided to have it removed, and it was about 2 weeks ago. So I went to the dermatologist, and I thought it was going to be a little scrape, but we have to, as oncologists, I'm not an oncologist, but even when I was in private practice, when we had to remove cancer, we want to make sure we get it all. So sometimes we have to take what we call a wider margin. So we had to surgically remove this little spot I had. And so when I went to the doctor, I thought it was going to be one little, scrape and a little stitch. Turned out to be a lot more aggressive and so a lot more invasive. So they had to take a much wider section. So they took about the size of a quarter, if you will. And afterwards, basically, I had a hole in my face. And so they said, well, we could just kind of squeeze the skin. We could, please let me know if my connection goes bad. Could take a piece of skin from somewhere else and place it on your face. And so that's what I elected to have done. So they took a little piece of skin from over here, actually a big piece, placed it right here. So it's skin graft. See, it looked pretty bad. Last week I had stitches. And so, but I'm really glad that I just want to make sure everybody's seeing me. I'm having a low connection. Bruce or Becky, just let me know if the low connection is causing an issue. I'll go try to move somewhere else. But anyway, so I really thought a skin Facebook Live to talk about skin cancer would be very appropriate because I just went through it myself. So luckily, I'm healed pretty well. I have a very little bit of makeup on right now, but it's really not something that I should have trouble with in the future. So I'm glad that I got it looked at. So I wanted to focus on skin cancer in our dogs and cats. So with cancer, it's basically cells that have just gone crazy. And when we look at cancer, we always want to see if it's benign or malignant. And so benign basically means it's slow growing. It's usually not invasive. It usually is not going to cause issues later on in life. And then malignant is going to be our bad kind. So the kinds that are fast growing. Sometimes they actually could lead to, unfortunately, death. Sometimes, so the organ that maybe they're attacking, so liver or something like that, or it metastasizes, so it's going to spread to other organs. So that's why we look at our lungs because we want to make sure, has the cancer spread to our lungs? Can cancer spread to the brain? And so that's the malignant type of cancer. So benign is, of course, much better. But we also have to think about some of our benign tumors can be locally aggressive. So I remember when I was in private practice, I had this dog come in and he had a fat ball, if you will, and they're not a bad type of cancer. It's just a big ball of fat. However, it got so large and it was just kind of here behind his arm that it prevented him from walking normally. And so we had to remove it. And it was about a 5-pound ball of fat. eventually. So, but it was easy to remove, and there was a lot of skin, so we could just pull it together. And so sometimes these benign tumors, we still want to have them removed because they're going to impede function for the pet. So it's really important that we get them checked out and watch them. And so, what is skin cancer? Well, cancer is categorized in different ways, like epithelial, which is skin cancers. There's connective tissue cancers. There's blood or immune cancers. There's nervous system cancers. There's miscellaneous cancers. So the skin cancers are what's affecting our external, so our skin, and it's usually something that we could typically see or feel. And so that's why I wanted to talk to pet owners today about that, because it's so important to make sure that we check our pets and look for these things. So whether it's a bump or it's a different skin color, that's what you're looking for. So it's really important to give your pets a once over. Often now they have a lot of fur, so it's hard. So giving them, touching them, rubbing them, going into the little places that you never would have thought that you should go into, like their armpits and things like that, you might actually, observe some skin problems that you want to have your veterinarian check out. And another place to not forget is actually inside the mouth. And so so some pets can get skin cancer, like a cancer. My own Doberman had malignant melanoma, oral melanoma in his gums. And I'm going to post a picture later on where I wouldn't have noticed it until I flipped up his gum, and I would have, or his lip, and I would have seen it. So one of the benefits of having a true a dental done on your pet, so having them under anesthesia and doing a dental, is that we could really do a good oral exam of the mouth, because for Duncan, that was a very aggressive type of cancer, and luckily I caught it soon enough where we could have it removed. So checking all the skin is so important. Now, what are the causes of skin cancer? Well, they're actually the same as humans. So it could be environment, nutrition, the sun. So cats can get, and dogs too, but cats we see a lot with squamous cell carcinoma on their noses. White dogs. I live in Florida, so the sun is really, a problem for us. So making sure if your pet gets shaved and they're getting sunburn and things like that. So the causes in skin cancer in humans is exactly the same as it is in our pets. So I wanted just to let you guys all know that to be on the lookout for something. And if you see something, what do you do? So I have a very good friend who's a cancer doctor, Dr. Sue Ettinger. She's an oncologist for dogs and cats, and she's up in New York. But and she's got a wonderful website for pet owners that has awesome resources. She's going to do a Facebook tonight on some type of cancer. I think it might be lymphoma, but check it out. So she has a great Facebook following for pet owners, and she does Facebook Lives as well. But she has a saying that's see something, do something. So if you see something, don't just ignore it and just think, oh, it's a ball of fat, right? Actually, we want to make sure that we get them checked out. And on Sue's website, on Dr. Sue's website, she actually has some skin maps. So it's basically kind of like an outline image of a dog or a cat. So that way you could kind of write where you see some issues and see if it's changing size or changing color over time. For us doctors, when we have a pet that comes into us for an evaluation, we actually will typically measure the lesion, if you will. And so we have some things called calipers, and these are Dr. Sue calipers. Look, that's how big my nose is. And we measure it. So like we can measure my little skin cancer. And what we want to do is see if it's rapidly growing or if it's remaining the same. And we always want to keep an eye on these things. But Dr. Sue has a great saying, and it's basically, when do you bring something in? When should you be worried about it? Well, if there's something on your pet's skin that's the size of a pea and it's been there for a month or longer, then you should have it checked out. So just think about a frozen pea, if you will, and if it's something like that and it's been there for a month or longer, then definitely have your veterinarian check it out. So what do? We will either take a needle and we'll do a cytology. So we'll poke a little needle into the bump, and we take out some cells and they look at it under a microscope. Or sometimes we have to take a sample of it, so we can do a biopsy. And so that's what they did with me. So they took a little biopsy, and we look under a microscope. Now sometimes we have to send them out to pathologists to look at, people smarter than me, to look at the cells under the microscope to see if it's really aggressive, and that's where they might determine if it's benign or malignant. Now, we also will always recommend to do some x-rays, because we do want to see, has it spread to the liver, has it spread to the lungs, and we're looking for things like that. So there's a lot of stuff that we might recommend to our families that are concerned, and if it comes back as an aggressive type of cancer, that we're definitely going to want to recommend. And so there's some treatment options. So sometimes we could treat medically if it's warranted. So some mast cell tumors, we might be treating medically. And then there's also surgical removal of them. So just like me on my face, I had to get my little cancer removed. We remove cancer from pets all the time. Now, it's kind of easy because we don't have to worry. Like for me, I have a little, vanity going on. So I wanted to make sure that my face didn't look horrible. And so that's why we did the little skin graft. But our pets are covered in fur, so we have a little bit more leeway to worry about the plastic surgeon part of it. However, if you think of the back of a cat's neck or a dog's neck, there's a lot of skin there, right? And so if we do take a piece out for cancer, we can usually put it together because there's a lot of extra skin. Sort of like, let's say, my belly sometimes. I could probably pull some skin. Or even on the side here, there was a lot of skin, so I got a little mini facelift, a part of this. But imagine, like my face here, there wasn't a lot of skin to pull to have it properly closed without giving me eyeball issues, or eyelid closing issues. So if they pulled this together, I wouldn't have been able to close it correctly. So they had to do the skin graft. And we see that sometimes in our pets. So either it's on their face or tight skin area. Like imagine your dog or your cat's leg, especially down south near the paw. There's not a lot of skin to pull together. So sometimes we may have to take some skin from the other parts and put it down there. But it's okay, because look at me. I'm not too bad. Sorry, the lighting, but there it is. And I've survived, and it's only 2 weeks old. So don't be scared to have some things surgically removed, because like for me, I am now completely fine. Although it was a benign type of cancer anyway, I don't have to worry about it growing and causing me problems in the future. So I want you to remember, if you see something, do something. Check it out to see what size it is. So if it's like a pea, you don't have to have fancy calipers like us doctors have. But if it's the size of a pea and it's been there for longer than a month, definitely get it checked out. And we have some resources. We're going to show you that picture of my dog's tumor. Well, it looked black, and I almost didn't recognize it because it could look like a freckle. But I knew that something was bad. And so he went and saw the veterinary cancer group in Southern California. My dear friend, Dr. Sarah Fiocchi, thank goodness I have good friends in the oncology world. And because although I'm a vet, I'm first a pet mom. And so I freaked out when I saw that. And so she took great care of me, and the whole veterinary cancer group of Southern California was awesome. And he had it removed, and he did really well. So don't be too scared when you see some stuff, but it's best that we have it looked at. The sooner the better, because the larger things get, they're much harder to control, or they may spread, and we want to catch things before they happen. So again, Dr. Sue Ettinger, the Dr. Sue Cancer Vet, we're putting up the links. Please do not hesitate to go check out her Facebook tonight. It's on lymphoma, and she's awesome and a dear friend of mine. And talk to your veterinarian if you're ever concerned about anything that you see on your pet. And remember, I'm just talking about skin cancer. There's also a lot of internal cancers that happen. And so seeing your vet and having your pet get a good physical exam, sometimes they may find things that you didn't see, but they could feel some things, or we look at x-rays and things like that. So don't be scared, but we do want to catch things the sooner the better that we can. So thank you guys for joining. This was a quick little Facebook Live on skin cancer. There are people way smarter than me that talk about this, like Dr. Sue or some of your oncologists in the area. So don't hesitate to reach out to your primary care veterinarian to find out if you do have a pet that needs to see an oncologist, who's the best in your area. So again, thank you guys. I'll see you next month with the next Facebook Live. Take care. Bye.